As we go to the phone lines and talk with our special guest, one of our medical experts from Maui Health, it's Dr. David Ulin. Good morning, Dr. Ulin.
Good morning, Shane. How are you, sir?
I'm good. You know, it's Aloha Friday. It's the weekend, and, we have you on the phone line. And we got some good questions this morning.
All right, so let's go.
All righty, here we go. This one comes, let's see. Am I at risk, doctor, for getting COVID-19 from products I receive in the mail?
Oh, man. That is a good one. And,
Yeah.
Shane, I've wondered about this one, too.
Me too.
So I was glad to look it up. We know that viruses can survive a short time on some surfaces. There was a recent study in the New England Journal of Medicine that found that COVID can last up to 72 hours on plastic, 48 hours on stainless steel, and 24 hours on cardboard. But since we all know it takes more than 24 hours for most of these packages to get here, it's probably safe. But, so the good news is, according to the CDC, there's no evidence to support transmission of COVID through the mail or packaged goods.
Okay.
If you really want to be careful, though, maybe you can leave your packages untouched for 72 hours. But, that's not me. I can't do that.
Me neither.
So the best thing is maybe put on some gloves, wipe it down with one of those nice cleaning wipes, unpack it outside, wash your hands, go about it. And, I guess the other thing I got to remember for myself is thank those mail carriers and delivery folks. They are such friends.
Yes, for sure. Let's put them on our first responders list too, right, Dr.
Yes,
Ulin?
sir.
All right, next question. Can I donate blood plasma for treatment of COVID-19? First, can you explain to us what blood plasma is?
Sure. So blood plasma is the part of the fluid in your blood that doesn't have any cells in it.
Got it.
So it's the fluidy part of that blood, and it's full of all kinds of protective things like antibodies. So when you've had the virus, the idea is that you have produced some great protective blood cells to fight off the virus. And the question is, could we use that protective coating there to help other people who are having a hard time fighting it off? And there's some pretty good work being done around this. And at Maui Memorial, we're working very hard on a campaign that works with the Mayo Clinic to support this in some very experimental ways. So if you think that you might qualify to donate blood plasma, that you've had the COVID and recovered, please call the Blood Bank of Hawaii. Some great folks there, and they'll walk you through it.
Awesome. Perfect advice. All right. Can you explain the differences in face coverings?
Yeah, man, I really hear this one a lot. Okay, so there are all kinds of different masks out there. Homemade masks, store-bought masks, surgical masks, and that rare animal called the N95. All kinds of interesting stuff. But the bottom line on masks is they're just as much about protecting others as they are about protecting you. So a cloth mask, or what we call a cover-your-cough mask, provides some great protection both for the user and for people around them. In the hospital, we worry about all these particulars, and the trick for us in the hospital is to match the mask to the task. But outside the hospital, it's more important that you wear it properly all the time when you're out in public, wash your hands before and after, and try to keep your hands away from touching your mask, which is really much easier said than done. Shane, it's kind of crazy to me. We used to only talk about masks when it was Halloween. Now it's just all the time.
Yes, it's become the new norm and probably will be in the future too.
Yeah,
all right.
You're right.
Dr. David, let's see. How long will we have to practice social distancing in your opinion?
Yeah, the zillion-dollar question.
Yes.
I know we all want to get back to our regular life, but it will likely be a while before we get a vaccine or a targeted agent against COVID-19. Social distancing has been very effective in slowing the spread of this virus. Hawaii and Maui are very lucky that our governor and mayor acted fast, stopped tourism, shut down our schools, sent us home, protected us. It's been hard, but it was the right thing. Relaxing these rules, I think, will be a calculated gamble.
Yeah.
So we must go slowly, watch for any new cases, test widely at the first concern. And if we see the number of cases pop up again, we'll likely have to go back under stricter measures. So I think we'll be doing some form of social distancing till there's a vaccine. Shane, it's a good thing we got you and KPOA to listen to, spending our time at home.
Thank you. You know, Dr. David Ulin, you're just one of the many people who has, come together with us and making this possible. And it's been a joy for me personally. I learned a lot. I'm not going to be going to medical school anytime soon, but, I have good friends like Dr. David Ulin, Dr. Lee Weiss, and all the many that has made this possible every morning. So on behalf of us here at KPO and Pacific Media Group, thank you for all of your work, Doctor.
Thank you. Stay safe, Maui. Aloha.
Aloha.